primary goal.
Hi guys, this is Dr. Jonas Apostol and welcome to my fourth vlog this 2024. I am so excited to share this beautiful case. Okay, so the patient is actually based abroad. So the patient complaint was she has this large porcelain fused to metal bridge and she was using polydent. The polydent was used to retain that bridge. Parang it acts like as adhesive, no? So it's not actually that wise to have that for a very long time because the main problem, if the tooth is exposed to the oral cavity, especially the prepped teeth, it can develop some sort of problem such as sensitivity, pwede mag-develop si caries, and a lot more. So we have to get rid of that problem. So nung pumunta si patient sa akin, I checked the case. We found out that it's not just about the bridge, but we have seen that there's a lot of concerns. Number one is the cavity of multiple teeth, especially dito sa front. As you can see here, it's kind of unequally distributed yung length, yung width ng kanyang two front teeth, and then you can see there's like problem with the restoration and also gum problem because of the impingement of the gum because of that restoration. So that's very important to note kasi if we do our restoration, it can make your teeth beautiful, but if it's not careful, it can actually ruin the gums. Number two is the caries, the cavity. Yung cavity na to, actually, if left untreated, it will grow bigger. Why? Because the caries or the cavity, it is defined as a microbiologic disease. A microbiologic disease that actually going bigger and bigger. So these are things that we have to be very, very keen on observing. So that's why our assessment is very, very important. That's how we establish a case. So a lot of concerns here as we delve deeper into the problem. It's not just about a beautiful smile. We are always looking at the relationship of the upper arch, the upper teeth and the lower teeth. It has to be in harmony yung relationship nila. Like when we move our jaw forward, backward, side to side, that's very important. If you have this kind of problem such as crossbite, it can develop certain problems such as TMJ. Okay, TMJ, temporomandibular joint disorder, which is common nowadays. So as we can see here, the totality of the condition of the mouth, we can see that the problem is not just, as what I have mentioned, the problem is not just on the front, the problem at the back. So dito, a lot of problems, and we concluded we did a treatment plan for the patient. So aatakihin natin to, which is number one, dapat hindi siya traumatic to the patient. It should be atraumatic. It should be efficient and fast. And because she's not based here, we have to move fast and we have also to be very accurate. So accuracy is one of the key in order for us to recreate the smile, which is healthy, functional, and beautiful. So for the patients naman, she needs to be more patient about the process because this is not like the usual thing. This actually includes yung endodontic treatment, yung root canal. Kasi may mga ngipin siya na kailangan talaga i-root canal because of the damage. So multiple, this is a multi-specialty approach case, no? Hindi lang endo but the perio itself, the gum specialist, the root canal specialist, and me, we took charge of the whole case because we want to make sure that whatever a ceramic it plays in, dapat maayos yung foundation. So the foundation, which is the tooth itself, it should be very stable and stern, because if it's not, the problem would be like the longevity of the restoration, which is very important on my part and the part also of my patient, because we don't want to put in there that it will not last, diba? After the preparation, we have to make sure that we give the patient a temporary. That the purpose of the temporization, the temporary, is to make sure that the patient will not experience severe sensitivity. Because if the patient will go home without the coating in there, a temporary to like coat the teeth, it will be very sensitive. Although the teeth, especially the vital teeth, were treated, we call it immediate dentin sealing, IDS procedure, which is very important for us to make sure that we protect the tooth structure from possible sensitivity. But it will not suffice without the presence of temporary. And after a week, syempre try in. Syempre kailangan namin i-check muna. Try natin muna, baka hindi siya papasok or baka nabablock yung gums ulit. So we need to make sure also na maayos. And the patient was happy during the try-in. Perfect. It's like bespoke, diba? I mean, lahat ng nuances, lahat ng details, we gave it everything. So, yun. Patient approved. And we cemented it. And after that, here's the final outcome. Okay? It looks natural. I mean, that's the goal. To have veneers, bridges, and crowns, kasi dito sa case na to, it's a combination case. For this type of case, kasi it's almost full mouth, it requires time for her to adapt to her case. It's not like super easy na parang pagkakabit pa, perfect agad. For some cases na parang, it will, Doc, parang up until now, parang hindi pa rin ako naka-adjust after like a month. Yeah, ganun talaga. For some cases, it will take a while for you to adapt and adjust. Kasi that's how the brain works eh. Hindi naman pagkakabit okay ka agad. But we run it with T-scan, the occlusion thing. We made sure that the bite is equally distributed. The symmetry, I checked everything. The relationship during the protrusive, retrusive, side-to-side lateral movements for function-wise. So I checked everything, and then I gave the patient night guard to protect the teeth while sleeping, no? Kasi if not, magkaka-problem tayo. So, a good case, and I know a lot of patients actually na pumupunta sa amin, they thought their case parang end game na, end stage na. Pero hindi. I mean, look at her smile. It's not even. Parang feeling mo parang wala lang. Parang wala nangyari. So, the best treatment pa rin should be prevention. Okay? That's the reason why we always encourage all our patients to visit their dentist, so that whatever problems na you have, we can be able to check and be able to discuss whatever treatment na pwede. So I hope you learned something today, and I hope some of you can relate to this case, which is a very good case. And I hope to see you all again on my next vlog. Thank you very much. So I'm gonna take this time to introduce my Apostol Institute to all dentists who wish to train with me and learn new things from me. And I'm gonna walk you through the process. I'm gonna teach you everything that I know when it comes to restorative and cosmetic dentistry. So watch out, Apostol Institute will be opened in the next few months. So I hope you guys could join us. So thank you again. Hope to see you all again on my next vlog.